smoke-free airplanes by Denise Orhan. Before regulations were introduced, smoking on airplanes was common, exposing both smokers and non-smokers to harmful secondhand smoke. This problem persisted due to the lack of regulations on smoking in public spaces and the cultural acceptance of smoking. Additionally, big tobacco companies and some airlines opposed the smoking ban due to financial incentives, prioritizing their profits over public health. To fight the ban, they advocated for ineffective smoking and non-smoking sections, dismissed the health risks of secondhand smoke exposure, and made misleading claims to protect their financial interests. Secondhand smoke exposure on planes caused detrimental side effects for flight attendants, including increased risk of breast, lung, and throat cancer. Exposure to secondhand smoke can also cause heart problems, reproductive issues, and respiratory infections, to name a few. Furthermore, the passengers and crew face significant safety risks, as plane fires caused by cigarettes were highly dangerous and have resulted in fatalities. The 1973 Varig Flight 820 crash, in which 124 people perished due to a fire caused by a lit cigarette, serves as a permanent reminder of the dangers of smoking on planes. Patty Young challenged the idea that smoking should be legal on planes due to the adverse effects that secondhand smoke had on her and her colleagues, many of whom had confessed that they had the lungs of a smoker despite not smoking. With the help of a married lawyer team, Young launched the first class action lawsuit against the big tobacco industry, as well as the first lawsuit against secondhand smoke exposure. Although she faced challenges including the opposition of big tobacco companies, as well as public disregard of her concerns, Young made a tremendous impact in the public health industry, protecting the health and safety of both passengers and crew. Factors that would need to be considered in this case are economic, cultural, social, and health-based. Airlines feared that they would face financial losses due to customer dissatisfaction if they banned smoking on planes, as smoking in public places was culturally accepted at this time. Fortunately, due to growing awareness of the risks of secondhand smoke exposure, there was also a growing social movement that increased public support against smoking on planes. Additionally, as more research linked exposure to smoking to serious diseases, health concerns were also a factor in this case. Although the tobacco industry, airlines, and smokers resisted the movement to stop smoking in planes, public support and increased awareness on the health and safety effects of smoking in planes created an opportunity to regulate smoking in other public spaces. Early efforts to ban smoking on airlines were unsuccessful due to a few reasons. First, smoking was considered socially acceptable during this time, and regulations were almost non-existent. Second, advocacy efforts did not make much progress as they were hindered by the powerful and influential smoking industry, which fought to keep regulations minimal in order to maximize their profits. The tobacco industry had a strong influence on government policies and worked to delay regulations to reduce smoking in public spaces. Additionally, airline companies were reluctant to enforce regulations on smoking due to concerns about potential customer dissatisfaction and financial losses. The alternative solutions to the health and safety problems created by smoking on airplanes include creating designated smoking sections on planes, improving ventilation systems, and implementing a full smoking ban. While creating designated smoking sections on planes gives smokers a specific area to smoke, it is an ineffective solution that does not fully combat the problems caused by secondhand smoke exposure or the risk of fire. Airplane ventilation systems do not prevent the smoke from spreading from the smoking section to the non-smoking section, exposing other passengers and crew to secondhand smoke. Improving ventilation systems on planes might seem like a compromise, however, it would be too costly for airlines and would not stop health risks for non-smokers. Also, it does not provide a solution to eliminate plane fires. As such, the most effective solution would be to implement a full smoking ban in airlines, as it fully gets rid of the secondhand smoke exposure and fire risks, preventing both passengers and crew. While this idea initially faced resistance, it ultimately drastically improved health and safety conditions on planes, leading to greater passenger satisfaction. To solve this problem in the future, there must be strict enforcement of smoking in planes and additional bans for other public spaces. This includes regular monitoring of compliance with no smoking policies on flights and penalties for smoking violations to discourage incompliance with new policies. Additionally, the airline smoking ban can be used as a model for similar bans in other areas, such as public transportation, restaurants, and other environments where there are public health and safety concerns regarding smoking. By expanding bans, we can also increase public health campaigns to continue educating people on the dangers of secondhand smoke. The implementation of a complete smoking ban on airplanes requires a structured action plan. For the first 3 months, we should raise public awareness through nationwide campaigns that highlight the dangers of secondhand smoke and airplane fires. Health organizations such as the CDC, American Heart Association, and the American Lung Association will distribute educational materials, garner public support, and increase awareness on this issue. From months 4 through 6, policy advocacy and creation should occur. Congressional lawmakers and airline executives should collaborate to enact strict no-smoking regulations while addressing economic concerns by presenting data on customer satisfaction after the ban. Finally, for the last 4 months, new policies on smoking should be heavily enforced and compliance monitoring should occur. This includes imposing fines for violations, training flight attendants to manage smoking-related incidents, and conducting routine inspections to ensure that policies are fully adhered to. The smoking ban on airplanes set a precedent that acted as a model for public health regulations worldwide. Similar policies were adopted in other countries, such as Australia, which implemented a strict no-smoking rule on flights. Australian airline passengers and crew saw significant health benefits from these new regulations, demonstrating the power of advocacy, intervention, and research in shaping policies to protect public health. Despite strong objections for the tobacco industry and airlines, the anti-smoking regulations were effective in improving air quality and reducing exposure to harmful secondhand smoke. This case serves as a model for future public health initiatives aimed at restricting health and safety hazards in public spaces.